Small hiccup. So again, welcome. Thank you, Tariq, and welcome to this press conference on the result and outcome of the joint study into the origin of the virus that was conducted in Wuhan, China in January and early February 2021. We, as you know, we went there as part of a long process that started last summer, where we agreed on the series of studies to be conducted to help us in the process of better understanding the origin of the virus. And that was including a series of epidemiological studies looking into the human side of the start of the outbreak, looking at the early cases in December 19, trying to find earlier cases than the one we knew, and also looking at other data available prior to December, samples kept from that time, data from surveillance systems of different syndrome and diseases that could give us clue about the possibility of having earlier cases than December 2019. We also look at the market where the first case were linked to, the Huanan wholesale seafood market in Wuhan. And we also looked at many studies that were conducted in the past few months in China on different animal species, trying to find or have a better idea of whether some animal species would be harboring this virus. We looked at all these studies. We received a lot of data, raw data, processed data, result of studies and analysis done locally, and we processed all that together with our Chinese counterparts. We also look at molecular and genetic data available to help us link all the other pieces together. We look at and analyzed all the sequences, genetic sequences of the virus coming from different sources in December 19 and January 2020 to try to give us a better picture of what we could find about the start of this event. In terms of key data we looked at on the epidemiology side, we looked, among other things, into data coming out of different surveillance systems. In particular, surveillance system looking at cases of fever, cases of unspecified pneumonia, ILI, and ARIS systems, which are respiratory syndromes that are picked up by different health facilities. So we look at more than 76,000 cases of these symptomatic individuals in the months before December to try to look if anything there could look like COVID cases that had not been picked up before. But at the end of the day, we didn't find anything. But this is only a first set of studies. And among other things, our recommendation is to look back in more detail into many of these data sets. We also look at the data around the confirmed cases in December 2019. The 174 cases we know were confirmed at that time in Wuhan. And there clearly, during the second half of December, we could see a surge of cases, both among the ones linked to the market, but increasingly as we move towards the end of December, increasingly cases not linked with the market, indicating that the disease was already at that time spreading outside in the different part of Wuhan. Therefore, the more we move into the second half of December, the less relevant the market itself become, because then the disease is spreading around. We also look at data from mortality statistics data to see, could we see any excess mortality, any sign of an excess number of deaths in the period before December 2019 in and around Wuhan and also elsewhere in the province. And we could not see anything happening before December. And clearly looking at this type of data, we could see that an upsurge of mortality in the numbers of deaths somehow in January, towards the start of January 2020, 20 in Wuhan, compatible with the fact that the number of cases was growing already at the end of December in the city. And we also could see that outside Wuhan, this increase in mortality came a little bit later, indicating again that the event, at least in the province, started in Wuhan and then moved more and more outside Wuhan. We also look, of course, at the market, the Huanan market. We went there, and it's a closed market now for more than a year, but it was still very interesting to see the setting, to see the state of the physical environment in which these events unfolded more than a year ago. And we also were able to map the entire market. It's a huge market with more than 1,500 vendors and shops, and mapping all of them with the different type of product they were selling, different type of meats, poultry, seafood, wild animal meat, etc., and could link that with both the positive environmental samples that were found in different surveys in the market, but also with the human cases, in particular in the early days of December. And by putting all these data together with the sequencing data, we could show that the virus was circulating in the market as early as the beginning of December 2019, but there were also cases not related to the markets outside the market of the Huanan market, with slightly differences in the genetic makeup of the virus these cases had, showing that there was probably some circulation in different parts of the city, unrelated to each other. And remember, the cases we picked up in December 2019 when only the severe cases. At that time, a COVID case was a case of severe pneumonia. All the mild cases were missed because they were not, at that time, we didn't know that there was many mild cases or even asymptomatic cases. So all these other cases were never picked up. And of course, they could help us get a much better understanding of the start of the epidemic if we had access or could detect these cases. We were also able, for each of the interesting vendors in the market, we were able to trace back their suppliers, in particular the shop selling farmed wild animals of much interest in our work. We could detect or identify the suppliers they were using all the way back to the farms, providing and raising these animals in different provinces of the country, and in particular in some provinces where we know that bat population interests are also there. So clearly pointing into interesting new studies to be conducted in the coming months. So again, this is only a first start. We've only scratched the surface of this very complex set of studies that need to be conducted, and we have pointed to many additional studies that should be conducted from now on. We were also able to do a lot of analysis on the genetic sequences of the virus that were isolated in December and early January at the start of the epidemic, and being able to see how these sequences were linked in evolution, meaning helping us to understand and try to understand where and when the start of the presence of the virus could be related to. And you will see that in the report, there is a lot of very detailed information and useful information that again point towards the need for very specific new studies. Chinese counterparts ahead of our coming were also conducting a large number of surveys on animals, different type of animals, wild animals, animals from zoos, animals from farms, domestic animals, etc. Dozens of thousands of animals were tested and all negative. So again, showing the difficulty of picking up a particular species as a potential intermediary host. And we also look in the process of helping us to prioritize our recommendations and prioritize studies to be conducted. We also looked at what are the different possible pathways for this virus entering the human population back in 2019. And that helped us organize our thoughts and prioritize our recommendations. And there we looked at 4 possible pathways for the introduction of the virus. One was a direct introduction from a host animal, from a reservoir, and that could be a bat or other animals where the virus had been initially present, directly into the human population. Then we looked at this scenario together with an intermediary host, meaning the virus would have first jumped into an animal, adapted into that animal population, and then jumped and adapted to the human population. And then we also look at the possibility of frozen food products or contaminated products being a vehicle for the virus, allowing the virus to enter in particular the Wuhan area from further away. And there, this interesting lead into frozen farmed wild animal products present and sold in the market, in foreign markets, are very interesting and warrant further studies to explore that hypothesis. And the last one, of course, was the possibility of a laboratory accident or leak. And in doing so, we looked at all the arguments for and the argument against we had for each of these hypotheses or each of these pathways. And we try to stay to what are the arguments we have, the hard facts we have. We try to stay away from suspicions, ideas, theories, and so on, because we couldn't really use that in a systematic way for all the hypotheses to help us moving forward. And there in that process, we then assessed the likelihood of each of these possible pathways and organized our recommendation towards the ones that were, as an outcome of our work, the most interesting to continue with. And in particular, with regards to the current joint group, the joint group of experts between Chinese experts and international experts, where and how this group can best and most in the most useful way conduct the necessary additional studies in better, again, exploring certain of these hypotheses and improving our understanding of the source of the virus. In closing, I'll just say that it has been an incredible experience. We really learned a lot. You will see if you dig into the report, it's a huge report. Can understand the challenge of going through that in a short period of time, but it's a huge report with a lot of new knowledge, a lot of data, a lot of new information. And I think a lot of work will continue to come out of these initial studies. We also, of course, have to thank hundreds and hundreds of people who made this work possible, both in the host country in China, facilitating all our work, gathering data, generating data together with us, but also huge logistical challenge to get us to Wuhan and stay there for a month. As you know, traveling these days is not easy. Bringing an entire team from outside is not easy. So it has been really a challenging time for the whole team to get there, do the work, and came out again. So on this, I would like to thank you all and give the floor over to Tariq. Tariq, over to you.